New at 6, Wisconsin is currently recruiting more doctors, dietitians, and therapists who are specially trained to deal with eating disorders, which have one of the highest fatality rates of any mental health disorder. And the pandemic has made matters worse. Hotline calls to the National Eating Disorders Association are up 70 to 80% in recent months. I spoke with experts in the field and a survivor to go deeper into the problem right here in Wisconsin.
Rachel Quast can barely keep up with the calls she gets from people seeking help. The uptick started just a few months into the pandemic and has stayed strong.
The most heartbreaking calls were within 1 week. I had two parents call with their 13-year-olds, both of them are suicidal.
Rachel is a certified counselor in Milwaukee and a national speaker on eating disorders. She's the creator of SHED, Self-Healing Through Education. Her own battle with eating disorders started when she was just 8 years old. By 14, she weighed only 54 pounds.
They said they didn't have a whole lot longer to live, and I believe it, just the way my heart was beating and things just were failing in my body, and I could tell.
She went through years of treatment and relapses for anorexia, bulimia, and binge eating. It wasn't until finding her own purpose in helping others and speaking out about the challenge that she truly found healing.
Stories like speaking at junior high and the counselor later telling me 3 kids came and confessed they were bulimic. Those are my okay, people are getting well, and that's really what I want for people so bad, is just complete, emotional, physical, spiritual wellness, wholeness. And so how can that not fill you up when you know, my pain is now serving other people?
Rachel has never seen the demand for eating disorder help so high. Neither has the UW health system.
We've seen numbers of patients with eating disorders nearly double between 2019 and 2020. We actually did have an increase in males admitted to the hospital with eating disorders last fall. This uptick is likely here to stay. I don't think it is a fluke, and I don't think it's going to go away once the pandemic goes away.
Dr. Paula Cody specializes in adolescent medicine for UW Health. She says the stress, loss of control, and isolation the pandemic prompted, coupled with increased social media use, photoshopped images, the billion-dollar diet industry, and people forced to look at themselves so often on a screen for virtual meetings in school, has intensified the problem. 62% of people in the U.S. with anorexia have experienced a worsening of symptoms through the pandemic. And nearly 35% of Americans with binge eating disorder, which is far more common, reported an increase of episodes. This all according to the Journal of Eating Disorders. This is all made worse by a shortage of available treatment options here in Wisconsin and nationwide.
Difficulty finding therapists because the therapists are overbooked. The demand is far outpacing the supply. And the eating disorder treatment facilities all have long wait lists as well.
Rachel and Dr. Cody are among health leaders in Wisconsin fighting for more resources.
Working with the insurance companies to help increase their coverage of mental health diagnoses, and even just nationwide increasing the number of beds that are available in treatment facilities for eating disorder patients.
And that's kind of where I see the big gap of help there, is those that don't have insurance or don't have money. Where do they get help?
They say eating disorders are often misunderstood as a white woman's disease, which means early signs are often missed among men or boys, who make up at least 25% of eating disorder cases, and particularly among people of color.
What I see is people are addressing it when it's severe. Can we not address it with young people?
In what often can feel like a hopeless situation, they want people struggling with eating disorders and their families to know you can overcome this.
You're never hopeless. You're never done. I don't care if you've been in it 50 years. Miracles happen. I've seen them. I've been one.
Now, if you or someone you know is struggling with an eating disorder, the best place to start is talking with a doctor. If you're waiting on specific treatment, there are organizations like the National Eating Disorders Association that can connect you to a mentor, someone to talk with over the phone, or a support group, some of them even online.